While Congress and the American people debate the direction of healthcare reform, my next guest has actually built his career around helping to create healthcare companies. Fred Nazem is the founder and the president and managing partner at Nazem Inc. And among the companies he has helped establish are Universal Health Services and Republic Health, now Tenet Healthcare. Fred, thank you very much for coming in. Good to see you. One of the issues that people always want to understand when they talk about healthcare is price, because it's not just a debate over the healthcare that's delivered, it's what's about the cost of that healthcare. What kind of comparables are out there in the world that maybe the U.S. consumers should learn about?
Well, that's what you're talking about is value, really. Are we getting value for our money? And the fact is that we're not.
No, why?
Well, it's just a lot of different layers of cost that has been historically built into it. And we can go into that. But basically, we are at least double the next biggest spender in Europe. And our healthcare isn't really that much better. We have some of the best healthcare in the world, and we have some of the worst. It's just the mixture is something we got to attend to and really blow quality into it. And speaking of quality, the only way you can get value would be to blow more quality into the system. And quality is the cost cutter #1, which is something that's lost on most people.
What do you mean by that when you say quality is the
If you take good care of people, and
preventive care,
for instance, and you know, the chronic care, which is really badly needed, then you begin to really change this whole landscape around. So I give a lot of credit to the president for taking this issue, which is a tough one, on. But now the stuff that is happening is all over the place. We got to get down to really bottom line of how do we do that. You're talking about price and value. Price is very expensive. We are spending about $8,000 per capita. Nobody could afford that, including ourselves. China and India have 2.5 million people, like half of the earth. If you multiply that by 8,000 per capita, it would be more than their GDP. And U.S. healthcare alone, and it's growing faster than both of those economies. So it's just untenable. And as a result, these nations, necessity is the mother of invention. They're finding lower cost products and you know, to deal with healthcare and services. So I think we can learn a lot from them as these new things develop over there by necessity. We can bring them back. We can also reduce the cost right here. We don't have to go overseas to do it. And this is something that myself and my partners are trying to do to really bring that.
But let me just break in. I mean, as someone that's created a lot of healthcare companies, what do you say to critics who point to outside the United States and say, you know, the innovation isn't there, the entrepreneurial spirit isn't there to go out and create new companies because they're never going to be able to recoup the investment. They're never going to really make the money that would be the incentive for going out and creating brand new medical devices.
First of all, I don't think that is really true. It used to be, and this is one of the things we just keep talking to ourselves into it. Innovation is happening all over the place, not quite the rate that is in the U.S. I mean, I think we are the innovators here. One of the irony is it's just like in the auto industry. I mean, Bendix produced some of the best innovation, and then Mercedes gets it and brings it back here to sell us the car. Some of our innovation is going overseas, is coming back in the form of other healthcare services and all that. So we got to watch for that. We don't mind other people using it, but the fact of the matter is that people are doing it. I'm known for having, you know, ushered in MRI into the business of healthcare, and I keep tab of it. I've seen a very inexpensive MRI machine that has tremendous pictures that comes out of them in China about 6 months ago. And, you know, you compare it, it's less than about 10% of the cost of what it is in here. So there's going to be innovation like that.
So don't get caught up in this, quote, conventional wisdom about entrepreneurialism and innovation. Let me ask you, because I want to get your thoughts on what's going on with patient care, because you were just saying before you came in that it is really about bringing the patient closer to the actual provider of health care.
Exactly. The problem that needs to be attended to, and the discussion should really focus on this than anything else. The other guys who really should not be in the middle of the discussion are in the middle of the discussion. Bottom line is that our system, and the Europeans and the rest have copied it, unfortunately, is top down. It starts with Medicare and the government, and then big insurance companies. I used to run one of them, and sort of dictating what it has to be. And the fact is that you and your doctor in a room, God forbid you got cancer, he's telling you or she's telling you, and with his pen or her pen, she's going to write what has to be written. Then we get into this fix. What he has written or she has written, then we got to fight to see who gets paid. So this is a very difficult situation. We got to go back to patient and patient focus. Basically healthcare system, and that's a long conversation, but I'd love to do.
All right, we're going to